Good afternoon. Will the Committee of Supply please come to order? Before we begin, I have a leave request for this section of Committee of Supply. Our long-standing practice is for the opposition to sit at the committee table to the right-hand side of the chairperson. Because the minister is participating virtually this afternoon, I am asking if there is leave of the committee to waive this practice. This would make it much easier for the members of the opposition to see the screens that are situated in the room. Is there leave? Agreed and so ordered. This section of Committee of Supply will now consider the estimates of the Department of Health. Does the Honourable Minister have an opening statement? And would they please introduce their staff that is with them? The Honourable Minister of Health.
Thank you, Mr. Chairperson. On behalf of the Department of Health, I'm very pleased to present the financial estimates for the 2022-23 fiscal year. In doing so, I commit to Manitobans that through this budget, we will continue to deliver high-quality health care in a safe, innovative, and sustainable manner to our patients, clients, residents, and families. As the supplement describes, we will continue to strive for positive results in the department and health system with dedicated focus on results in the areas of improving access, improving health service experience, improving patient safety, ensuring affordability, and health system spending. The proposed 2022-23 health budget in core represents the largest investment in healthcare in our history, just over $6.2 billion. More specifically, the Department of Health now reflects a 2022-23 expenditure in core of $6.273 billion. This represents a $146.1 million increase from the 2021-22 budget, or a 2.4% increase. In terms of summary, the 2022-23 health sector summary budget is set at $6.687 billion. The COVID-19 pandemic has had significant and far-reaching collateral impacts on many aspects of the healthcare system. The magnitude of the COVID-19 pandemic backlog challenge includes surgical and diagnostic waits, cancer screening and diagnoses, and waits and increase in demands for other important services to Manitobans. The Manitoba government has created a diagnostic and surgical recovery task force to address the diagnostic and surgical backlog challenges. The 5-point plan includes the following actions. 1, improve the capacity of the existing provincial health system to deliver activity. 2, increase provincial capacity through more intensive healthcare purchasing efforts. 3, engage the front line in finding solutions. 4, apply innovations developed locally and globally. 5, engage citizens and community in identifying challenges and finding solutions. The Manitoba government already recognized that significant financial resources were needed to address these multiple challenges. Budget 2021 contained a total of $50 million to support the backlogs in activity in that fiscal year alone. Budget 2022 continues to address the pandemic backlog by providing a total of $110 million to aid in the recovery from COVID-19 related to surgical and diagnostic backlogs. This $110 million is on top of the amounts I referenced in our core budget. On the topic of COVID-19, our government continues to proactively budget for and set aside amounts in respect to pressures from COVID-19. And again, on top of the core amounts I noted earlier for health, our government has established an amount of $630 million in 2022-23 for the ongoing COVID-19 response and other contingencies. In addition to the budget I just spoke about, and in response to the unprecedented pressure placed on the provincial healthcare system as a result of COVID-19, an initial investment of $9 million is committed to establish a higher baseline ICU bed level in Manitoba. A further $4.2 million and 18 additional term FTEs will be provided to CADAM Provincial Lab to support core and COVID-19 operations. Budget 2022 includes other key investments and enhancements in the delivery of health services. I will now take a few moments to describe some of these investments. Health has made large commitments related to funding for wages and benefits. Manitoba spends approximately 73 cents on every dollar in hospitals and healthcare facilities on salaries and benefits for the workforce. The total investment made in respect of these resources amounts to $87.2 million in budget 2022. For the 2022-23 fiscal year, over $12.6 million in incremental operating funding has been made available to support the annual operating costs of the following new capital projects in Manitoba. The acute stroke unit at HSC, an increase of $8 million, in addition to $1.7 million in funding provided in 2021-22. Rest Haven Personal Care Home, an increase of $2 million, in addition to $4 million in funding provided in 2021-22 for 83 incremental beds. Cancer Care Manitoba, an increase of $2.7 million to support several cancer initiatives. An investment of $7.6 million is being provided for emergency response services, including for hiring of 35 additional primary care paramedics as part of the government's commitment to hire an additional 80 paramedics. Increased capacity for life-saving dialysis treatment for those living with end-stage chronic kidney disease. And we've budgeted an additional $1.8 million for 2022-23 and plan to invest in capacity for more dialysis spaces in Manitoba. This includes both in-center and home dialysis for those who wish to deliver or receive care in the privacy of their home. Since 2015-16, $34.1 million in total funding has been approved to expand dialysis capacity. Funding of $10.9 million will be made in support of Manitoba's PharmaCare program. This will include a 2.1% increase in anticipated price increases, as well as 2.4% increase in prescription volumes and additional funding for drugs for rare diseases. In addition, we continue with our plans announced in 2021 to provide improved coverage for insulin pumps and glucose monitors to help those suffering with diabetes. Although delayed by COVID-19, Wave 2 of the health system transformation continues to implement Manitoba's clinical and preventative services plan. The CPSP is focused on sustaining health services into the future so that care is optimized, guiding investments in rural and northern healthcare, digital health supports, and infrastructure investment in projects and program delivery. And we continue to advance the implementation of Manitoba's CPSP, including the unprecedented $8.2 million capital plan that was announced last year in Budget 2021. New hospitals are in planning for Nepo and Portage-la-Prairie, and many other infrastructure improvement projects are underway across the province. In Winnipeg, our government was very pleased to announce the progress made on the St. Boniface Hospital Emergency Department project. The $141 million project will improve patient care, reduce wait times, and meet growing demands for the future. The health system and those who work in it have been providing care during a once-in-a-lifetime pandemic, arguably the most difficult period in recent memory. Now they're hard at work on recovery from the backlogs and stabilizing from the pandemic. Our government has made historic investments in Budget 2022 to help our valued healthcare providers do this important work. Historically, the Canada Health Transfer played an important role in helping support provincial and territorial health services. In 2017-2018, the federal government cut growth in the CHT from a fixed 6% per year to a 3-year moving average of nominal gross domestic product growth, with funding guaranteed to increase by 3% per year. The decrease in the CHT's growth rate since 2017-2018 has reduced the overall federal contribution through the CHT in supporting total healthcare costs in Canada, resulting in billions of dollars less in healthcare funding for provinces and territories. For Manitoba, it means a reduction of $739 million in total when compared to what would have been received during this period under the previous formula. By 2021, provinces and territories were paying about 78% of total healthcare costs in Canada, while the federal government paid only about 22%. Sustaining the health care levels to respond to Manitobans' greatest healthcare needs going forward requires an increase in the CHT of provincial and territorial.
Honourable Minister's time has expired. We thank the Minister for those comments, and would the Minister introduce her staff at this time?
So
the Honourable Minister of Health.
Thank you, Mr. Chairperson. Here with me today is Karen Hurd, the Deputy Minister of Health, Sandra Hinault, Assistant Deputy Minister and Executive Financial Officer, Finance Shared Services for all three departments, Manitoba Health.
Does the critic from the official opposition have an opening statement? Yes. The Honourable Member for Union Station.
So I'd like to start by thanking the staff who are supporting the proceedings today. We know how hard you folks work, and we genuinely appreciate your support and your efforts made so that we can do this work in this building and on behalf of Manitobans. I also want to thank all of those who are working in our healthcare system during this very challenging time. It is currently Nurse Appreciation Week, and it's also Allied Healthcare Professionals Week. And those folks most certainly deserve our thanks for everything that they have done and are doing. And beyond our thanks, they also deserve real action to address the ongoing crisis and challenges that they're facing in our healthcare system. The pandemic has posed exceptional challenges to our healthcare system. As we've previously discussed, years of closures and consolidation left Manitoba uniquely unprepared for a public health emergency. We've seen the impacts of that in terms of healthcare outcomes throughout this pandemic, unfortunately being some of the worst across North America. We know that capacity in our healthcare system was cut, beds were closed, critical care was cut, emergency rooms were consolidated. Unfortunately, over the last year, things have gotten worse in the healthcare system. We're facing a record backlog for surgeries and diagnostic tests. Wait times at emergency rooms are also breaking records. Facilities in rural and northern Manitoba also face incredible challenges, including what the northern region describes as a very fragile state of sites and services across the region. This cannot be overstated, and I'm grateful for our colleagues who represent the North in our caucus, NDP caucus, who have been advocating tirelessly for folks who reside in the North and in rural communities. In addition, my colleague for Point Douglas will spend some time inquiring of the government regarding the very serious addictions crisis, the crisis of unmet basic needs, and the crisis of unaddressed childhood trauma and trauma generally, and how that manifests in our province. The addiction support the government has put forward are simply inadequate to deal with the problem at hand, and much more must be done. My colleague will get into more of those details by way of questions throughout this process. I want to thank the health staff who are supporting today's proceedings under what are very challenging circumstances. Appreciate you very much, and thank you for your expertise throughout estimates. Thank you.
We thank the member for that statement. Under Manitoba practice, debate on the minister's salary is the last item considered for a department in the Committee of Supply. Accordingly, we shall now defer consideration of line item 21.1 brackets A contained in Resolution 21.1. According to our Rule 77 brackets 16, during the consideration of departmental estimates, questioning for each department shall proceed in a global manner, with the questions put separately on all resolutions once the official opposition critic indicates that questioning has concluded. Before I open the floor for questions, I would just like to remind everybody to please give a proper signal with your hand for myself to recognize you, so that way there's no mistakes of the cameras and the mics being turned on prematurely. The floor is now open for questions. The Honourable Member for Union Station.
I'd like to start today by actually sharing a response to a Freedom of Information request we received, which I'm happy to table. It shows the discharge disposition of patients at St. Boniface Hospital's cardiac unit over 6 years. So in 2015 and 16, 69 patients were discharged because they died. In 2018 and 19, it was 115 patients. In 2019 and 20, it was 157. Clearly, these numbers predate the pandemic. The rise in these numbers predate the pandemic. Can the minister explain this rise in deaths in cardiac units at St. Boniface Hospital?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I thank the member for Union Station for the question. I would like to take it under advisement. That information is not available at this time.
The Honourable Member for Union Station.
Thank you. So a memo from Victoria General Hospital that was leaked recently, I know the minister is well aware of this, refers to a bed crisis. That description is a direct quote from the memo. The memo says that at all sites across the region, this will mean pulling more patients out of the emergency rooms to wherever patient care space can be created, in some cases in non-traditional locations. That, again, is quoted directly from this memo that was leaked. What is the minister doing to address this bed crisis? If she could outline maybe the immediate actions that she's taking, and then more generally what steps are taking to address this bed crisis.
The Honourable Minister of Health.
Thank you, Mr. Chairperson. And I thank the member for Union Station for the question. It is my understanding from health system leadership that the Victoria General Hospital is experiencing a surge in patient demand at this time, and a number of initiatives are being implemented and developed to lower emergency as well as urgent care wait times and reduce the backlogs at these sites. These ideas are coming forward from engagement and conversation with staff that work right in the urgent care, assisting patients. And so some of the ideas that have come forward is the leveling of transport arrivals across all sites, improving the lab turnaround time for patients requiring admission. I understand that these are temporary, and I stress and emphasize the word temporary measures. The individuals that are being moved, I'm assured, are ambulatory, they're low acuity patients, they're close to being discharged within 24 to 48 hours. They're independent and relatively low care needs. The spaces they're moved to are monitored by staff. They're equipped with all necessary equipment and are locations where patients who are expected to be discharged again within a short period of time. Our healthcare facilities continue to communicate with these patients and staff about moves and plans for managing the surge. We know that these are challenging circumstances. I do want to recognize the professionalism and dedication of all our staff to ensure patients are receiving quality care in a safe manner. Mr. Chairperson, thank you.
The Honourable Member for Union Station.
I thank the minister for that response. I'm sure the minister would agree that however temporary folks are being put in hallways or in staff lounges or wherever staff are creatively being able to find space to provide care, that for any amount of time, that is unacceptable, that it is not what Manitobans should come to expect when they access healthcare in our province. And that these temporary measures, the reality of it is that they're a direct result of decisions that this government has made leading up to the pandemic, including cutting 124 beds from our hospitals. And so, knowing that, I'm sure the minister recognizes that this circumstance, no one should ever expect to be experiencing this in healthcare, and it places an incredible burden on top of what is already a really challenging time for healthcare workers to try and meet those healthcare needs in that kind of an environment, as creative as they are finding these solutions. Can the minister commit to restoring the 124 beds that have been lost in the last few years that have contributed to the state of things right now?
The Honourable Minister of Health.
Thank you, Mr. Chairperson, and I thank the honourable member for Union Station for the question. I'm reviewing some high data, Canadian Information for Institute for Health Information data for 2020-2021, and it shows the total number of beds for each of the provinces and territories. And they're listed in a ranked order. And Manitoba was at 4,170, up from 4,132. I'm not aware of the bed closures, the member references. Of course, during the pandemic, there has been pressures and challenges on the health system to staff beds as a result of redeployment of staff, individuals who may have chosen throughout the 2 years to seek employment elsewhere. And so there were challenges, and you can't keep a bed open unless you have it staffed. So those decisions are not being made here in the ministry. It's being made in each and every facility by leadership to ensure that individuals who occupy those beds are receiving care from the right ratio and complement of staff. But if the member for Union Station could be more specific about the number that they are putting on the record, that would be appreciated, because we are not familiar with those closures. Thank you, Mr. Chairperson.
The Honourable Member for Union Station.
So the 124, I thank the minister for that response. That number, which has been raised in question period a number of times to this point, comes from the WRHA annual report. So that's information that the minister should have readily available, and again has been raised a number of times in the past many weeks. So if the minister is able to clarify how those beds are going to be reinstated, that would be great. But certainly I won't spend too much time on that if the minister is not willing to commit to reinstating those 124 beds that were cut. What I would like to be able to get into is whether or not the minister can provide the amounts regions have spent on nursing agencies. This is a really important question. It's a question that I certainly understand if the minister doesn't have all of the data available to her, an undertaking would be fine. But if the minister could provide the amount regions have spent on nursing agencies, broken out by region for the fiscal year of 2021 and 22, that would be great.
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I thank the honourable member for Union Station for the question. I just want to clarify that the fiscal year is 21-22, and if that is accurate, we would not have those numbers as of yet. We're just in the process of finalizing the end of the fiscal year numbers. So please clarify that it is the fiscal year that has just ended.
The Honourable Member for Union Station.
Would the minister be willing to take that as an undertaking?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. Yes, we will take that under advisement and provide a response.
The Honourable Member for Union Station.
Thank the minister for agreeing to do so. Similarly to my question on those stats, is the minister able to, and broken down by area, so for example, surgery, ER, urgent care, etc., and by region, would the minister be able to provide us a current vacancy report for nurses?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I thank the honourable member for Union Station for the opportunity to put some words on the record about our government's investment in nurses. So we have invested nearly 1,600 nurse training seats now, over double the 700 the previous NDP government had when they took power. We're graduating 15% more nurses than the NDP ever did. $19.5 million has been invested to add 259 nurse training seats this year, and that will be at 5 post-secondary institutions as part of our larger plan to add close to 400 new nursing education seats. Mr. Chairperson, on top of these investments, we're hiring 35 more paramedics across our province. And I want to highlight that 149 nurses have completed their intensive care unit nurse training program since last April. 93 nurses as well in the last year have completed the 12-week critical care orientation program to be able to help support our intensive care units. And 30 more nurses have signed up for the program just this past February. And I've shared a number of times that last year I was pleased as a first-time health minister to participate in the Rady Faculty of Health Sciences College of Nursing nurses graduation ceremony. And 115 nurses graduated at that time. And there will be even more graduating this spring. $4.3 million for 37 additional nurse training seats at the University College of the North is an investment where we will see more nurses being able to provide care throughout various facilities in our northern and remote communities. And we're supporting hundreds of internationally educated nurse applicants to obtain their licensure and start practicing in Manitoba with up to $23,000 of financial aid per person. And that may not sound like a lot to those around the table today, but to someone who's a newcomer trying to get back into their field of practice from their previous country of origin. That is a lot. And our undergraduate nurse employees program. Last December, 63 third and fourth year nursing students joined care teams to support the delivery of health services for Manitobans. And this will allow them to gain invaluable paid experience in a clinical setting. And 159 more nursing students will start by the end of April. And so we are ensuring that we provide opportunities right here in our province for new nurses, for internationally educated nurses, to be able to practice in their area of passion and expertise. It's about making Manitoba more welcoming. And welcoming doesn't just mean to individuals that are coming to our province from another country or another province. It's about people who have grown up here and went to school here and spent their entire life here. And now they want to stay here at home in Manitoba and practice in their area of passion and expertise. And so we're ensuring that Manitoba welcomes them into our health system. So pleased to be able to have several discussions with the Manitoba Nurses Union, the College of Registered Nurses of Manitoba, on how we can Manitoba remains open and a welcoming place for those who want to be in the nursing profession. I've said many times that it's a very rewarding and fulfilling profession, and we want to keep it that way. And that is why we've also added 60 new full-time nursing positions to intensive care units. And that's not just here in Winnipeg at St. Boniface and Health Sciences Centre, but it's also in Brandon and Grace Hospital. And it's about what this week is all about, National Nursing Week. It's thanking nurses, it's appreciating them, it's valuing them, and making sure they know that.
Honourable Minister's time has expired. The Honourable Member for Union Station.
I thank the Minister for that response. I didn't hear an answer to my question in regards to whether or not the Minister will provide, broken out by area and by region, a current vacancy report for nurses. I would appreciate if the Minister could provide clarity on that point. But I just want to also state that I agree with the Minister that Manitoba should be a welcoming place for nurses. People should be excited, whether they're new grads or they're relocating from any place. They should be excited to work here in Manitoba, which is why I'm sure the Minister is concerned, as I'm concerned, as my colleagues are concerned, that hundreds of nurses are no longer working in Manitoba since the PCs came into government in 2016. We have lost hundreds of nurses in Manitoba, unfortunately. And, this announcement that the government made in July of 2021 of last year, that close to 400 new nursing seats would be added over the next next few years. It was not as specific as 4 years, it was next few years. It was kind of vague that way. Was an announcement that they continue to tout, but there's a real lack of clarity in terms of what that means in the immediate. And so, in December, there were more specifics identified for this year by the government, including that they were adding 259 nurse training seats starting this year. So just looking for some clarity on those announcements in terms of where things are at. Can the Minister update how many of the seats she anticipates will be in place this year as previously announced? And I would welcome the Minister answering the question that I asked previously. Again, if she cannot provide the data right now, and taking it under advisement would be fine.
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I thank the honorable member for Union Station for the question. Again, I just want to highlight the investment that our government is making, $19.5 million to add 259 nurse training seats this year at 5 post-secondary institutions. As part of our larger plan to add close to 400 new nursing education seats, we are on track to, we continue to work with some of our institutions, and I can confirm that by the end of the year, we will have 30 new seats at Red River College Polytech, 12 at RN at Brandon University, 20 RPNs, Winnipeg at 5 at Université de St. Boniface, 7 for Flin Flon through the University College of the North, 20 through Thompson, again, University College of the North, and over 120 at University of Manitoba. And we continue to have discussions with a couple of institutions to fulfill our target of 259. Thank you, Mr. Chair.
The Honourable Member for Union Station.
I thank the minister for providing those details. Again, I will highlight that the minister has yet to provide the information regarding the reporting of vacancies for nurses by region, by area. And so, again, I would ask if the minister is willing to take that as an undertaking. That's fine, that's great, actually, if she's willing to commit to provide that information. It is really important information for us to know very clearly what the vacancy rates are for nurses by area, by region. But I do thank the minister for providing the information in regards to the seats per institution that she's just provided. I do, just doing quick math, see that it does not total the 259 seats that were identified by the government, but the minister has indicated they're still working toward that number. So I'd like to ask actually now about a question I asked last year at estimates. The former health minister, now premier, said that at Cadam Labs, there were no plans to move forward with private arrangements. And that was, again, the former health minister made that statement, now premier. I'm wondering if that's still the case. Are there any plans for a public-private partnership or any other private arrangement at Cadam Labs?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I thank the Honourable Member for Union Station for the question. We have in this province, and I know that the member for Union Station is aware from prior employment in the health system, that we have a wide variety of lab services throughout the province. And there are private labs, always has been, even during the NDP government's time. We will always have a public health lab. That is CADM Lab. They work closely with diagnostics at Shared Health. And I'm not aware of any plans to privatize CADM Labs. I'm not aware of that.
The Honourable Member for Union Station.
I thank the minister for that response. I will make a final note that as of yet, the minister has not committed to providing any information regarding nurse vacancies by area and by region. Given the fact that the minister is touting, and has been for quite some time, all of these efforts that she and her government are making around addressing the nursing shortage crisis that we have, I would think she would be eager, in fact, to provide this information. So I'm not quite sure where the resistance is in terms of providing this data. It's important information that the minister should, I would think, be eager to make available. So in regards to nursing, the minister talked about 120 seats at the University of Manitoba. I'm wondering if the minister could provide clarity around whether or not those 120 seats are going to be coming online this year. And also the minister stated that nurse graduation is up 15%. That data isn't consistent with data that I have gone over, quite frankly, and I'm just wondering if the minister can shed some light on that for me and provide the nurse graduation rate by institution. And that way, hopefully they can line that up with the 15% increase that she's saying for graduation rates. So if the minister could cover those two items, that would be wonderful.
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I thank the Honourable Member for Union Station for the question. I do want to go back and add to the record some information about CADM Labs, CADM Provincial Laboratory Services. If the member looks at the supplement to the estimates of expenditure for 2022-23 on page 39, they will see that for 22-23, there has been an increase to support CADM Provincial Laboratory pandemic response and to enhance their service capacity. Again, a public lab, and we are enhancing supports. And there's actually been an increase in FTEs as well as dollars for the CADM Provincial Lab. To the member's question about the 120 seats at University of Manitoba, I can confirm that yes, they will come online this year. And with regard to the member's question about the 15% that has been stated a number of times, that is an overall increase over time since our government took power. And they may be looking at year over year. We are not. We are taking a overall approach to that percentage that we are reporting. Thank you, Mr. Chairperson.
The Honourable Member for Union Station.
Can Can the minister provide the nurse graduation information by institution?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I thank the honourable member for Union Station for that question. I do have available some breakdowns, but it is not by graduation, by institution. So I will have to take that under advisement and provide a response at a later time.
The Honourable Member for Union Station.
Thank you, Mr. Chair. And thank you, Minister, for that, agreeing to take that under advisement. Can the minister tell me how many personal care home beds that's occupied or available there currently are in the province? And to be clear, I would ask for the most recent figures that would exclude Parkview Place and any other beds which have been removed from our system.
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I thank the member, the honourable member for Union Station for the question. It gives me an opportunity to put on the record our government's investment in budget 2022. So we're investing care. And I just want to say that that's more money than the previous NDP government ever spent. In 2016-17, PCH funding was 644,129. In 22-23, the funding is 661,734. More
I'd like to interrupt the minister as we have lost your video. I don't know why we, like, if you could check your camera.
Yeah, they have it back on. We're just going to try and center it.
Can you see it now?
The Honourable Minister of Health, yes, we can see you. Please proceed.
Thank you, Mr. Chairperson. Since we took office, we've built 506 PCH beds. In our first 2 years in government, we built almost twice as many PCH beds in Winnipeg as the NDP did from 2010 to 2016. And in 2020, we announced a historic $280 million investment in safety upgrades to our PCHs. And then budget 2022 will invest $32 million to implement all 17 recommendations of Dr. Stevenson's report to improve care for Manitobans at all 125 personal care homes in the province. And so these investments include increase in staffing within personal care homes to ensure seniors get the quality care they deserve. It also includes investing in new personal care home beds. We're also strengthening seniors care by investing $20 million to implement the new senior strategy. Mr. Chairperson, this makes good on our government's promise to respect and protect the dignity and independence of our seniors. And I just want to take an opportunity to highlight that it was our government that announced the first seniors and long-term care ministry with a minister, deputy minister, and a full department. And their consultation, engagement, and work has begun with talking to individuals that service seniors across our province. And more good work is going to be announced by the minister responsible for seniors and long-term care in the not too distant future. Thank you, Mr. Chairperson.
The honourable member for Union Station.
Can the minister tell me how many personal care home beds occupied or available there currently are in the province? To be clear, I would ask for the most recent figures that exclude Parkview and any other beds which have recently been removed. It's a pretty clear question. Hopefully this time the minister will provide a clear response. Thank you.
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I thank the honourable member for Union Station for the question. I am pleased to share that by region, for Southern Tabor Home, it's located in Morden, new 100-bed PCH, and that replaced the existing 60-bed PCH, so net new beds was 40, and the provincial contribution was more than $35 million. And it was occupied in the fall of 2017. In the WRHA Holy Family Home in Winnipeg, redevelopment of existing facility, 116 beds for a new total of 157 beds. Net new is 41. Our provincial government's contribution over $61 million. That was occupied in the summer of 2019. In Southern Regional Health Authority, the Boyne Lodge in Carman, and I was pleased as Minister of Health to be there for the ribbon cutting, so to speak, on that facility. It was a redevelopment of existing facility, 70 beds for a new total of 106. The net new is 36. With the provincial contribution over $28 million. That was occupied in the fall of 2021. And in Southern Regional Health Authority, Rest Haven Home, and it's located in Steinbach, redevelopment of the existing facility, 60 beds for a new total of 143. So net new beds is 83. Our provincial government's investment was over $35 million. And that will be coming online. You will hear of an announcement very soon this spring. Thank you, Mr. Chair.
The Honourable Member for Union Station.
I thank the minister for providing that breakdown. I am going to go back to that question about personal care home beds. There's I think some clarity that I want to get there, but for right now, I'd like to ask about the vacancy rate in the insured benefits branch. At last I checked, the vacancy rate was at 25%. We've heard from a number of Manitobans who are having an incredibly hard time getting their health cards, extreme delays in getting health cards. This is a huge issue. I know the minister is aware because myself and several of my colleagues, we have written letters to the minister regarding this issue. It has been raised a number of times. Can the minister explain why the vacancy rate is so high in that branch and what steps she's taking to address it immediately?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I thank the honorable member for Union Station for the question. The challenges that exist throughout this province in terms of staffing positions and in all the sectors has certainly impacted the health department as well. And the branch is making concerted efforts to advertise their vacancies and to as quickly as possible receive applications, screen those applications, hold interviews, make offers, and so in some cases they're having to repost some positions, which is not good. But it has impacted all sectors and all levels of government. And so we thank all the people that are showing up every day in that branch to provide services. But I also want to take this opportunity to talk a little bit about our very successful vaccination campaign. And I just feel so proud as a health minister to report that over 1.1 million Manitobans rolled up their sleeves to receive 2 doses of the vaccine. And we continue to work on increasing the numbers for the 3rd dose, encouraging individuals to get their 4th dose as they become eligible. Several are now. And that is what led to over 82% of eligible Manitobans being fully vaccinated. And it's the highest rate among the prairie provinces. So I just wanted to put that on the record as well. And again, over 44% of Manitobans have gotten a booster shot. And we continue to ensure that as the National Advisory Committee on Immunization comes out with more opportunities for Manitobans to become fully vaccinated and to receive their boosters, that our vaccination campaign, our ads, our social media, our radio, our print ads keep pace with those changes so that we can keep all Manitobans safe, get everyone back to work, not just in our department, but in all sectors of the province where there's staffing shortages. And our goal as a government is to fill those vacancies as quickly as possible, because it's people on the front lines that build Manitoba's economy. And it's about building up the economy and making sure that Manitoba continues to be a thriving province and a place where people want to come to live, to work, play, and enjoy living here for years to come. Thank you, Mr. Chair.
The Honourable Member for Union Station.
I thank the minister for her response. As promised, I'm going to go back to the personal care home question that I asked. The minister didn't provide the answer to the question I asked specifically, and so I'm going to ask it again. I'm looking for a system-wide number in terms of how many beds occupied or available are there currently in the province. The minister is well aware of the fact that her government promised 1,200 personal care home beds. There are currently less beds than when they started. So, this is an important point. The minister has the information. How many personal care home beds, occupied or available, are there currently in the province right now?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. And I thank the Honourable Member for Union Station for the question. And I know that the Honourable Member worked in the health system for a very long time and can relate to how it evolves and changes over time. And that is without a 2+ year pandemic. What the pandemic has provided is an opportunity to take a look at the types of personal care home beds, the types of community supports that our seniors need. And in some cases, we've had personal care homes say they would like to have the opportunity to change the configuration of their bed base from the standard PCH bed to more like, for example, behavioral beds. So we have been working very closely with those PCHs to ensure that the current needs that are before them, not the way we envisioned for long-term care, personal care homes back in the 70s or even the 60s, continues to take hold when what we need is a different configuration. And it's also given us an opportunity to work with our home care program to ask the question of, do we need to enhance home care services? Do we need to provide more supports to keep people aging in place, and not just aging in place, but in their current setting, in their home? Where studies, I'm sure the member for Union Station has read some of these over time, our health profession studies continue to show that the best place for someone to rehab after a surgery or to recover after a health incident is in the home. And so we continue to see individuals who want to have their home care services enhanced so that they can stay in their home. So our focus is on meeting the needs of Manitobans now and engaging with seniors and long-term care providers, SDOs, and facilities. But our support for seniors has not wavered, and that is why for personal care homes, Budget 2022 is investing over $661 million in personal care homes. We want to ensure that there's also investments to improve the services and the care and the settings, the infrastructure within our personal care home, which is again why Budget 2022 is investing $32 million to implement all 17 recommendations that came forward from Dr. Stevenson's report. And that's to improve care for Manitobans at all 125 personal care homes in the province. I think that is substantial. I think that needs to be said many times. Again, investments include increase in staffing within personal care homes to ensure seniors get the quality care they deserve, and strengthening seniors' care by investing that $20 million to implement the new senior strategy will certainly help to respect and protect the dignity and independence of our seniors. So our commitment has not wavered, but we're certainly open to engaging with facilities, with leadership of long-term care about what makes sense now. Our province is evolving, changing, seniors are changing. I know my mother just turned 90 years old. She's still independent, living in her own condo. She doesn't want to go to a personal care home, but we've enhanced her home care services. So it's talking about what makes sense now to each and every senior in our province. And Mr. Chair, we're going to continue as a province to have those engagements, have those discussions. We don't want to get locked into any one way of doing things. It's about being, if it taught us anything, it's to be flexible.
The Honourable Minister's time has expired. The Honourable Member for Union Station.
I thank the minister for that response. I think I need a bit more clarity, because to me it sounds like the minister is saying that her government's commitment to build 1,200 new personal care home beds, the minister is essentially saying that that's not going to happen. The minister saying that your commitment hasn't wavered, but that things have changed. There are other areas that we need to look at. I mean, the areas that the minister outlined in terms of, investing in aging in place, addressing home care, all of these increased staffing, whether it's, in-home care, long-term care homes, all of these areas are areas that require meaningful investment, full stop. These are all areas that we're seeing have significant challenges before the pandemic due to cuts, during this pandemic. The minister would be more than well aware of these issues. I know she's hearing from Manitobans about these areas and the concerns and the challenges that people are facing. But I guess what I'm trying to understand is, these are all areas that need to be invested in meaningfully. These are all areas that are struggling, that need to be addressed. Is the minister saying flat out that the commitment that her government made to Manitobans to build 1,200 personal care home beds, that's no longer a promise that they intend to keep? Is the minister saying that establishing, hundreds, over 1,000, but a significant amount of new personal care home beds is just no longer part of the plan? Because that's essentially what the minister has just identified. I mean, consultation engagement's important. People have made very clear, however, to point to this date, rather, what is needed and necessary. And again, the minister has the information available to her in terms of system-wide how many personal care home beds there currently are occupied or available. So I would ask the minister to provide that clear data, that clear number, and provide clarity as to whether or not I'm interpreting what she says as they've abandoned that promise to Manitobans, that they're not looking at establishing the personal care home beds that are needed, and that some sort of vague statements around areas that we all know need to be meaningfully invested in, but the minister has yet to, and her government has yet to provide any sort of a plan in those areas. So if she could provide a clear number, occupied or available beds across the system in our province, and provide clarity around the statements that she's made in terms of this government not fulfilling their promise to Manitobans.
The Honourable Minister of Health.
Thank you, Mr. Chairperson, and I want to thank the Honourable Member for Union Station for their words. I do want to state for the record that our commitment as a government to seniors has not changed, or to our PCHs have not changed, but we're certainly respectful of the PCHs' choices about how they provide those services. And a really good example is Action Marguerite. They have converted, they decided, this was back in 2019, to eliminate their double rooms. So 16 beds on the C wing of the ABC Tower. And they say that it was similar to projects undertaken in 2011 and 2014. And so they state that it represented the last series of rooms to be converted from a shared living space to a private space. And it was 10,000 square feet. And that resulted in, once the project was complete, in Action Marguerite St. Boniface's bed map dropping from 299 to 292 beds. Now, as a government, we wouldn't want to say, stop everything, we don't want you to do that. because again, we're respecting the organization's decision on how they want to provide services and the type of atmosphere they want to provide services within their facility. So changes could be outside of the government's control. Another really good example is Boyne Lodge. So when the first phase of the new Boyne Lodge was announced, it featured clusters of single resident rooms with washrooms and showers that formed a local neighborhood of 9 to 10 resident rooms. And each neighborhood included a kitchen, dining, and activity space, as well as private lounge areas, storage, utility, and resident use laundry. The overall facility includes large multi-purpose gathering spaces, offices, staff areas, maintenance and housekeeping service areas, and exterior patios, walkways, and parking. And I was pleased to be the health minister at the time when we opened the 105-bed personal care home. But again, this is just an example of how personal care home settings are evolving and changing. And our government wants to be responsive and respectful of those changes. When an organization like Action Marguerite comes forward to the WRHA and says, we want to eliminate double rooms, this is what we want to do, but it will lead to a bed drop. We don't want to, as a government, say, don't do that, because that is respectful engagement. That is allowing the organization to evolve and change to meet the needs of the resident population that they serve. So our government's commitment has not wavered. What we are doing is ensuring that facilities know that they can come to us and they can have discussions about what makes sense now in terms of any changes they want to make to their current bed base. Again, some have come forward and said they want more behavioral beds. And so that has to change in terms of the bed base. So our government, and I know the Minister for Seniors and Long-Term Care will echo my words today, has not changed. But we are going to continue to be open to having discussions with our long-term care facilities, the leadership at those sites, because seniors are changing. Their needs are changing. And what they're expecting, even within a personal care home setting, is changing. And we want to be respectful and aware of that and have those discussions about what our PCH facilities should look like, how should the beds be structured, and we certainly don't want to take away from those discussions.
The Honourable Minister's time has expired. The Honourable Member for Union Station.
I thank the Minister for her response, which unfortunately did not include the information I've asked for now several times, and is information the Minister has readily available to her. It's disappointing because, you know, this is a question in terms of the occupied or available beds that are currently in the province that's very, very straightforward. It's a question the Minister should be very, very quick to answer and provide and be transparent about. You know, the Minister is providing a lot of, her thoughts on approach, provides very little detail and data that would really shine a light on the actions, legitimate actions her government is taking. And so it's disappointing that after asking that question several times, the Minister just simply has no interest in providing the information that, you know, I'm here asking on behalf of Manitobans. You know, it's a question that I hear from folks that I represent as their MLA, and more broadly from folks throughout the province. And it's disheartening that the Minister would just outright refuse to provide a clear number today. So I'm going to move on from that and just acknowledge that, you know, a really simple question yet again goes unanswered by this Minister. I'm going to ask a question about St. Boniface Hospital emergency room and the renovations. Again, very straightforward question I'm going to ask. I hope the minister is willing to provide a clear answer here. So can the minister just provide an update for us as to the status of the renovations rather at the St. Boniface emergency room, most specifically when that project will be complete, is projected to be complete, and what is the budgeted cost?